Okay, good evening, and thank you for joining us. One of the things that I promised as mayor was that I would make sure that the people of Flint know the information about the status of their water when I know about it and as soon as I know about it. And that's why I've asked you here to join me, along with the Federal Response Coordinator, Dr. Nicole Laurie, and Dr. Eden Wells, the Chief Medical Officer for Michigan Department of Health and Human Services, Mark Durno from the EPA, as well as Dr. Mona Hannah Atisha from Hurley Medical Center. I've had many meetings over the last few weeks with federal representatives here to assist the city of Flint and our residents. And part of the federal response to assist the people of Flint has been to increase resources available to speed up the testing of lead within homes. And we've been pleased to see that Flint residents picking up the water test kits at the water distribution sites throughout the city. Over the past 24 hours, results from these tests have been coming back from Michigan Department of Environmental Quality. And I have been informed that in a few of these results, the water showed levels of lead above 150 parts per billion. The water filters we are currently distributing are rated to safely remove lead up to 150 parts per billion. So this obviously raises the concern about the few instances where the test results showed levels above 150. While the number of homes tested is still small, there is still concern. And I feel it's important for the people of Flint to hear these results and understand from the experts about what these results mean. We are standing here together to make sure that the people of Flint know the information that we know as soon as we know. Because if we can't trust each other, then we're not going to be able to move our city forward. I also want to say that these results show the importance of getting your water tested. So I want to encourage every resident of Flint to go to a water distribution site and get a free water testing kit. You don't have to test the water yourself. You just have to come and get the container, go to your house and put water in that container and bring it back to us. It's really important that everyone gets their water tested. Now, to further explain the ramifications of these water results, I've asked Dr. Laurie from the Department of Health and Human Services to come and speak on this issue. Dr. Laurie, please.
Hi everybody, as you heard, I'm Dr. Nicole Laurie. I'm the Assistant Secretary for Preparedness and Response at the U.S. Department of Health and Human Services, and I'm here on behalf of the U.S. government to support the city and state response effort for the people of Flint. Every community needs and deserves safe drinking water, and understandably, residents here are scared for themselves and for their loved ones, and are looking for a solution they can count on so they don't have to worry about what drinking a glass of water will do to their health or the health of their children. As President Obama indicated when he declared an emergency, we are committed to doing whatever we can to support this community. That's why I'm here. We're looking across the federal government at ways we can use our programs and our expertise to help the city and state ensure immediate access to safe water and a safe water supply. Over the past 2 weeks, the federal government has really ramped up support for the people of Flint, bringing in technical experts from Health and Human Services, the Centers for Disease Control and Prevention, the Environmental Protection Agency, FEMA, the U.S. Department of Agriculture, Housing and Urban Development, and the Department of Education. Part of the federal response to assist the people of Flint has also been to increase resources available to speed up testing of lead levels within homes. As Mayor Weaver said, as part of our support, and in collaboration, the Department of Environmental Quality has been testing the water system here to see how well the lead prevention programs are working. We want to be sure that your water is safe. But some of the tests are of water in homes before the water goes through the filter, and I want to stress that, before the water goes through the filter. And over the past 24 hours, the results from these tests have been coming back, and we noticed that some of the water samples showed lead levels above 150 parts per billion. We aren't completely sure why. It could be the way the samples were collected, so EPA, in partnership with the Department of Environmental Quality, has been getting on it right away They've been out all day getting water samples and testing, and will be doing more testing this whole weekend and early next week to figure out why and exactly what that means. But this number of 150 is important because the water filters distributed to Flint residents are rated by NSF, the National Science Foundation, to remove lead at levels up to 150 parts per billion. So I want to stress, this does not mean that we think there's a problem with the filters. In fact, everything we know tells us that they are performing well. But it does mean that we need to do additional testing at homes with levels higher than 150 parts per billion to be sure. In other words, we've got to double check this. We spoke about these results today with Dr. Mark Edwards from Virginia Tech, and he told us actually that during the water crisis in Washington, D.C. in 2010, he tested the ability of these filters to remove lead from water and found that the filters continued to be effective at removing lead at even much higher levels. So that's very encouraging. Meanwhile, people with levels over 150 are being notified as the county gets the results back, and their water is being retested. As Mayor Weaver said, out of an abundance of caution, pregnant women and children under the age of 6 should use bottled water for drinking and preparing food until the EPA finishes the additional testing and we know more. We're trying to do this as quickly as we can. Obviously, if you've already gotten a test back and it's under 150 and you've been told your water is safe, continue to use the filters, okay? But to be clear, if you don't know, let's act out of an abundance of caution. Our experience with public health crises show that the circumstances can change really quickly, and we are committed to sharing information with you immediately so you can take steps to protect yourself and your family. While EPA continues testing the water, CDC is working with residents and with the county and state health departments to learn everything we can about how many people have been exposed to lead in their water, how much lead they've been exposed to. Please talk with your doctor about a blood test for your child if your child hasn't been tested, and have them check for lead. To meet the near-term physical and mental health needs of children, pregnant women, and families impacted by lead, the USDA's Food and Nutrition Service is working with mothers in WIC, the Women, Infants, and Children's Program, to provide ready-to-feed formula which does not need to be mixed with water. USDA has approved the Michigan Department of Education's request for additional money to serve more fresh fruits and vegetables. These funds will be used to help affected schools purchase foods that are high in calcium and iron and vitamin C, because these types of fruits and vegetables can help children who have been exposed to lead. We know that the residents of Flint are extremely worried for their health and safety in this crisis, and we're very concerned too. Experts across the federal government will continue to work with Mayor Weaver and others like Dr. Edwards and Dr. Hanna-Tisha to fully understand exactly what's happening here at Flint. Together, we will find a solution. And in the meantime, please remember, as the mayor said, to continue bringing water in for testing. Thank you. I'll turn this over to Dr. Hanna-Tisha.
I would just like to reiterate what has already been said. Please use extra precautions for those special populations, pregnant women and babies on formula. So please use bottled water for those populations because they're most vulnerable. It's great to hear this news so quickly. It's great to have the increased transparency, and it's great to have immediate action in place. So I think we are towards the path of recovery, and it's reassuring to have so much federal experts on the ground helping expedite this process. So thank you.
I would say if people have questions, we're happy to take the public questions.
Can you clarify, are you suggesting that if people have a filter in place and their water has not been tested, that pregnant women and children under 6 should not be drinking tap water even with a filter?
I think for right now, until the water hasn't been tested, in an abundance of caution, that would be the recommendation. We'd urge people to get their water to be tested as quickly as possible. The turnaround is very short, okay? So people can pick up a water tasting kit, bring it to numerous places, a fire station, the health department, lots of other places. I think right now the turnaround's about 3 days. If the lead levels are elevated, you'll be notified right away, and there's additionally information on the website.
And just to
You might want to
clarify,
go
I'm
ahead.
sorry.
Yeah,
Thank you. We were just talking about that, and I think for folks who would like to know that the water tests are actually just a 3-day backlog. So the tests, once they're reported, are getting up on the website. This is a website we'd like everybody to be able to tap into. You can find also many other good resources and information, both from our federal, local, and state colleagues here. That is michigan.gov, G-O-V, / Flint Water, and Flint Water is one word, michigan.gov/Flint Water. And please, if there's questions or if people aren't understanding maybe how to interpret what's there in terms of a test result or anything, please contact us at 211. You can actually get linked to the appropriate person to answer your questions anytime. So thank you.
You said that there's a small number, considering the amount of homes we have in Flint. Do we have a number on maybe how many came back with more than 150 parts per billion?
Yes, there's under 30, so approximately 20, actually are 26 sites that we know. Our local health department has contacted those. Our toxicologist was made aware of those water test results. Once she flags any that are over 150 parts per billion, there's an immediate contact in the local health department so that there's a contact with the family. And we do have a confirmation that those families have been reached.
So those are all residential homes, no businesses, schools?
I don't have that specific information at all. I just know that there is those sites.
Is that a hotspot or is that widespread across the city?
I would gather that it is a random selection, and I'm not aware that they're concentrating in one particular area, but my colleague here may be able to give you better information, because I do more blood and he's good at water, so I'll turn it over to Mark.
And I'm sorry, those were homes that had a filter in place, no?
No, the samples that were collected by homeowners without the filter in place. Okay, so it was raw water coming into the sample. The samples that we're going to collect, actually we started it today. We collected from a number of homes today already with homes that have a circumstance, are being collected with the filter in place. So the primary purpose of the testing that we're doing is to ensure that the water that comes through the filter is safe to drink. To answer your question, we looked at the addresses. We haven't had a chance to plot them on the map because this has all happened so fast, but it looks like it's random, just based on the address.
But sir, a lot of people. Why did they use that particular land?
I'm sorry?
Why did they use that particular land? From what understanding I have is that land manufactures anthrax.
That's nothing that I'm aware of.
The truck driver told me as he loaded.
Okay. Well, that's not nothing that we're aware of. So,
sir, can you explain the lead levels in terms that our viewers would understand on the scale of severity from the samplings that you got? How
Sure.
serious are that?
Sure. So the level, there's several thresholds. 5 parts per billion is one threshold that we look at for safe drinking water. 15 parts per billion is a threshold that we look at for regulatory compliance issues with water. So 150 parts per billion is 10 times that level. So anything over 150 parts per billion are the ones that we're targeting to ensure that these filters are effective. And again, these filters, as Dr. Lurie and the mayor stated, are rated to be effective to 150 parts per billion.
So what does that tell you about the lead levels in the river now?
The water coming in is not from the Flint River. This water is
Or rather with the pipes in general, I mean,
No.
with the pipes, I mean.
The water in the system itself?
Yeah.
Well, we're sampling the water in the taps. We're not sampling the water in the pipes.
Sir, how many, those 26 or 27 readings above 150 parts per billion, over what period of time did you discover those? And how broad was the overall sample? 27 out of?
Thousands. Thousands. I believe we're up close to I think it's close to 4,000 samples. I believe the number was over 3,900. We'd have to double check that number.
And what's the
Time frame?
How long of a period has it been that you found those 26?
Well, we just learned about these this week, and the first 6 we learned about within the last day and a half, and we've already reached out to those residents, and the remainder after those first 6 we're going to be reaching out to over the next couple of days.
So those were call this an abundance of caution. These filters are rated to 150 parts per billion or less. Are you telling people that do not have not had their water tested don't drink it at all, even if it goes through the filter at this point, until we know, because of the possibilities of lead getting into their water if that filter isn't sufficient enough to take care of it?
We're telling you we still have confidence in filters. And if you have not had your water tested, get it tested now. We've talked to a number of our experts at EPA. We've talked to Dr. Edwards and other experts with respect to these filters. We talked to the organization that rated the filters. We're confident that these filters work. However, as was stated earlier, we're doing this to ensure that some of these homes that have higher levels of lead in them coming out of the faucet are being properly treated by these filters.
These homes that have higher levels of lead, do you know if there are any children in the A1 homes specifically at all?
I'd have to check with our health partners to know which homes have children and which don't. We're reaching out to every home.
The people in these homes, have you told them just don't drink the water at all?
With the county health department reaches out to the homes. They tell them, especially the ones that are well above that level, that they should not drink the water until these samples are collected. And again, the first set of samples that we did today, a couple of those were the highest levels that we've seen. So we're going to be able to share some data here, if not this weekend, then early next week, about these exceptionally high levels. And if we're seeing that the filters are effective in these couple of cases, that's going to really send a strong message about the effectiveness of these filters moving forward.
And if it doesn't, I mean, does that say something else?
If it doesn't, then we'll let you know right away, and this team will figure out the next step.
Highest levels you've ever seen from the beginning, from when Elvis started, is that what you were alluding to?
No, we're alluding to the highest levels that we've seen with this particular sample.
What's the highest reading you found?
I don't know the exact number, but it was at least 4,000.
And the tests that you're telling us about today that registered over 150, I just want to make sure I'm clear on that. Those were all collected during what period of time?
Oh, since the last week of December.
And those were all water that was taken directly from the tap, not after it had gone through a filter.
That's correct.
So water that had gone after, it had been tested after it had gone through a filter, what kind of testing, have you seen any results on any of that?
We have not, unless any of the partner agencies have done any of that testing, but this will be the first round of evaluating the effectiveness of these filters.
Got it.
Just the other day, Dr. Edwards said that he saw that the pipes are healing as far as getting that protective coat back into it. Then you drop this on us. Is there light at the end of the tunnel? Are people going to be able to drink this water ever again without this infrastructure being pulled out of their place?
That's why we're in town. We're in town to get to the point where the water is safe to drink again. EPA is taking on 3 primary sampling missions. One of the sampling missions that we initiated yesterday, outside of what I just described, is to do that very thing. Start evaluating the quality of the water to see if the system is healing. They're very small, scientific, systematic sampling efforts that we're doing. And over the next several weeks, we're going to be able to give you a status of the health of the system moving forward.
Well, can you tell us about the infrastructure mapping and the information sharing, what you know about the lead lines now, and where they are, and updating the maps?
We do have a team working on that, and unfortunately they're not here right now, so I really can't comment for them.
Did those samples come from homes with lead service lines?
That's one of the assessment techniques that we're doing to determine if there's lead in the fixtures themselves, or to determine if there's lead in the service line. The way that we sample, we can distinguish that.
Do we know that?
Do you have any evidence that shows? Do you have any evidence that shows that these pipes are starting to replenish, or get better?
I've only heard what you've heard, that the data suggests that the water is improving. However, we're really not going to give you a concrete answer on that until we start collecting some of this additional data over the next few weeks. So, Mayor?
Excuse me, just wanted to let you know that I had gotten a call earlier today. We met, and as soon as we got this information, we came forward to inform the public because we said we wanted to let you all know as soon as we know, and we will continue to do that. So I thank you all for coming out this evening.